am concerned about distracted drivers, so it's up to me and you. I promise to focus on the road and keep my hands on the wheel at all times. I will not text or use my phone while I am driving. The number one thing you can do to help is put your phone away and encourage others to do the same. I'm Sunita, and safety starts with me.
Good. Good morning. I'd like to call to order the Health and Human Services Committee meeting for February 18th, 2025. The time is 9:30. If the clerk could please call the roll.
Yes, good morning. Councilmember Yambe.
Here.
Councilmember Herrera.
Here.
Councilmember Kruver.
Here.
Councilmember Ayala.
Here.
And Councilmember Hitchin.
Here.
You have 5 members present.
And 5 members present means we have a quorum. Everybody is here this morning, so appreciation. We have an agenda with 1 set of minutes and a work plan review. Any changes or additions to our meeting this morning? Seeing none, we'll consider the agenda approved. We do have minutes from February 4th, 2025. Any corrections or changes? Seeing none, we will consider the February 4th, 2025 minutes approved as presented, and that brings us to our one and only piece of business this morning, which is to review our work plan. So we're going to go to Ms. Waterland.
Good morning, Madam Chair, members of the committee. For the record, Carrie Waterland, staff for this committee. Starting on page 3 of your packet, you will see the draft of your 2025 committee work plan. What I did based on the conversation that you all had last time was take your ideas, and if anybody's interested in the backup of this work, I'm more than happy to share these big buckets with you. But I took your information, broke it down into 9 different kind of buckets that were sort of themes, and then from there sort of broke it down into some ideas of what you could consider for presentations. And then the task of plugging them in happened. And so a best attempt was made to have these topics sort of flow and either build off each other or just have sequence in that topic area. Once that was populated, I sat down with the chair and vice chair to go over those big themes to make sure that we didn't miss anything from their review and that your voices were honored and heard and plugged into this work plan. We got most of the way through, and there are, I think, opportunities that the chair purposefully left open for conversation today. I do have the Word version also open in front of me, so I'll be taking notes. So if you see me kind of looking up and down, that's what I'm doing, is taking notes for any updates that you may select on this work plan. So again, without further ado, it starts on page 3. And the easiest way, Madam Chair, would you like me to just sort of go topically and pause if folks have any questions?
Yeah, we'll kind of maybe go by page and see if people have questions.
Okay, sounds great. You have already, as you well know, considered and passed legislation out of this committee on February 4th. Today, February 18th, is the day set to review and finalize the topics on this work plan. Then your next meeting, the first one of March, is the first day that you will have a presentation on the comprehensive plan to end homelessness projects. It's the Q4 updates of the 2024 partner engagement and spend plan. Devin Isaacson from the Human Services Department will be here to present that information. Then diving into your ideas, on March 18th, you will be potentially having a presentation from the Human Services Department to look at elder care and aging well, which is a review of services in Pierce County, an overview of the current services for seniors in Pierce County. Then building off of that and or supplementing that would be April 1st, Senior Services, Meeting Diverse Needs and Addressing Barriers. This is looking at adapting services for seniors potentially. Transportation barriers were also brought up by members of this committee as something to consider for senior services. So again, these are just high-level ideas that were pulled out to give some thought kind of sparks for each of you. Then on April 15th, we slated tentatively because the Human Services Department does need to come in and give an update on the Behavioral Health Improvement Plan. That will be your day for looking at that. that could look at the Behavioral Health Improvement Plan and the Human Services Department providing updates on contracts, updates on the studies that they have going so far, and any legislative updates that you may need to be aware of in regard to behavioral health that look like they either did pass the legislature or will pass the legislature, depending on when they sine die. April 29th is your 5th Tuesday, and that is a hold as needed, depending on chair, if you feel that there is legislation or anything of need to hold a meeting that day. On May 6th, this is something from your 2024 work plan that the committee did not get around to hearing that you've now put back on, which is healthy youth survey data and trends. This would be Healthcare Authority, Department of Health from the state, potentially looking at the Tacoma Pierce County Health Department and Pierce County specific data from that healthy youth survey. And then the last on this page is creating safe and accessible spaces for youth, which would be looking at the expansion of childcare in existing spaces, potentially looking at collaborating with, and again, these are ideas pulled from members of this committee, collaborating with libraries, churches, community centers. An addition of discussing rural areas in that capacity is also something to consider. And with that, I will pause for any feedback on page 1.
Okay. So I'll look to my colleagues to see, and Councilmember Krueger, I didn't see your light come on, and I did test it. Okay. We will get you a new microphone. She's Robin now. Okay. I will still do Councilmember Krueger, even though it says Denson on my thing.
Thank you, Chair. I don't know if this is something that we should maybe at the end look at, but I was wondering in the elder care and the senior services together, would it be prudent for us to look at what kind of dollars we have available to expand on this, or working with what we have, how to make what services that are there better? Because it doesn't make sense if we go through this and say, oh, well, we need $50 million and we have $500,000. And then the holding a meeting as needed. I wouldn't mind something from Health Department on the septic. I prefer that be sooner rather than later. And the Healthy Youth Survey, in looking at these trends, I'd like to maybe dive deeper into the purpose of going through that. It just seems kind of perhaps redundant with that. Maybe that is something Birth to 25 should present on. And I didn't know if you want to do this page by page like that, or
I thought if there were specific things, and then there's
maybe do
2 pages,
that kind
so
of
that was like
summary at the end.
Yeah.
Okay.
If there's specifics, or if there's trends or things that are missing, that could be at the end. But just looking at her going through each page and just highlighting what is, because there's not a lot of words here, so giving her a chance to kind of share. So, so I guess to clarify the septic question, I got the impression that you wanted that for the whole council. You wanted it to come to Health and Human Services.
That would be whatever you choose. I prefer whole council, but maybe it could start here if need be. I didn't know where it might plug in.
Okay.
So it's open to discretion.
Okay.
On that, just so it gets covered.
Okay, perfect. It would fall under us because I think the health department is in the little matrix for this committee. So, but I thought there was interest more broadly than this committee. So, so we can see where it can happen sooner. Maybe
it could start here and then get filtered out and go.
Okay.
And then
to your comments about elder care, senior services, I think that's one of the things to think about anytime we have anything coming to this committee that has a nexus to our budget work is maybe using that opportunity to ask what are the budget implications, just again to kind of learn as we go instead of the deluge that will happen when we get to budget. Is that part of your intent, but also not just?
That is, which kind of leads me to, which this might be a discussion for when we're done, but in prioritizing maybe on a scale of 1 to 10, the different items that we are doing here, are senior services a 10, or is it getting more money than what is already expended on, say, the Birth to 25? They get the millions from the tax. So how do we navigate that in terms of importance of how we prioritize the work and the plans for them? Does that make sense?
I think so. Okay. So we will go to Councilmember Youngberg.
Thank you, Madam Chair. I just wanted to clarify and make sure that on one of the senior topics that we cover it's just a component, but the senior nutrition services, because I know that after going down to Olympia, it sounds like the situation from their end does not seem optimistic about being able to address the very expensive needs of making sure that we have senior nutrition services in the budget. So that might be a topic that we can at least discuss and go over, because I think it would be helpful to the whole committee to look at the situation and how we can try or not to, just get on the same page of what the situation is. And so that's my comment.
Thank you. Any other feedback? And again, we can always come back, but any other thoughts on this first page? Vice Chair Ayala?
Thank you, Chair. I think the suggestions I've heard thus far, I think, are really important for this topic, but also sprinkled throughout. So similar to what you said around if there are budget implications, really targeting some budget conversations on this. The way I have phrased this in my notes is particular to senior services and elder care is affordability. And affordability in terms of how our population will look like 5-10 years from now. So if we could do some forward casting on that within that topic, that would be great.
By 2030, a quarter of our population will be over the age of 60. So, okay, so we will go to the longer page, the second page.
Wonderful. Thank you so much. So starting on this second page, June 3rd, looks at leveraging youth employment and job readiness programs for economic mobility. That could be anything between youth-specific employment programs and or programs that teach leadership skills. This could also be a number of the youth sports programs that have been discussed that, again, teach leadership and other skills that will make youth employment ready. June 17th is kind of an or just some things for you to consider it may be two. The intersection of technology and wellness, which could be looking at the future of mental health care and or the role of artificial intelligence and the impact on youth mental health services, depending on if this committee wanted to focus on youth or kind of a whole person systemic look. Of note, wanting to make sure that the committee voice was acknowledged, that I think there is a balanced opportunity for presentations in this. It's new and emerging, and so it could focus on things like apps. It could also focus on data and trends that folks are seeing in existing programs like telehealth and telemedicine. Then on July 1st, right on time for the July 4th holiday, proposing that you hear a presentation on nutrition and whole person health, which is kind of unlocking that connection of nutrition and physical wellness, and looking at better outcomes, including all health-related services, and that's in quotes to kind of really drive home that can be inclusive of everything that we consider to be driving health. And then that could be also inclusive of data from the Tacoma-Pierce County Health Department. July 15th is potential and proposed committee reduction week. July 29th is your 5th Tuesday, which would be, again, a meeting hold as needed. August 5th is looking at expanding opioid treatment programs in Pierce County, any challenges or opportunities that this council should be aware of. potential for looking at co-occurring and wraparound services on this particular topic, though opioid treatment programs primarily fall in that substance use disorder realm. Many, I think, programs are looking at also the need for caring for behavioral health and mental health needs in general of individuals who may be receiving opioid treatment services. And so this could look at also presenting, are there any co-occurring programs or folks that are offering wraparound services? Then on August 19th, looking at fentanyl awareness, that could be looking at campaigns that are currently existing or other campaigns for consideration on preventing overdose, increasing community education around fentanyl. On September 2nd would be looking at improving pharmacy and service access in rural and underserved areas. One topic to maybe consider are barriers to accessing health services in pharmacies and including distance and limited hours. Then September 16th, this is a longer page. Then September 16th is addressing community health needs in Pierce County, which would be looking at identifying key health needs and gaps in Pierce County communities. September 30th is again a 5th Tuesday, which would be a meeting hold as needed. October 17th looks at third spaces and creating community gathering points in suburban areas. October 21st has been left open for topics, primarily for discussion, and knowing that October 21st doesn't necessarily need to be that day that is a new topic. You can move things around that exist on this, plunk it in there, and a new topic can go to where one is. November 4th would be looking at veterans' mental health, addressing unique needs and barriers for veterans. November 18th would be looking at, I went a little far, reentry and housing, the role of housing in successful reintegration. I know that reentry was mentioned in a few different capacities by folks in this committee during discussion. And after talking with the chair, there may be a few topics that might be appropriate in a different committee. And so if you don't see something like the Department of Corrections update, that may be something that is up for a discussion in a different committee. So this one would focus on really the human services aspect of reentry and looking at housing in that role of supportive housing. December 2nd, you would look at peer supports and the role that peers play in recovery. And they provide what's called a community-centered approach. Peer supports also, you may have also heard folks with lived experience as another kind of phrase. And so that would be inclusive of all of that. December 16th would be mental health crisis services in schools, which would be looking at proactive strategies for intervention in schools in crisis. And you could explore kind of programs where mental health crisis services are integrated into the school system, looking on early identification and early intervention. And then December 30th, again, is your 5th Tuesday, and that is a hold tentatively for a decision on what to do. And with that, Madam Chair, I did go into page 3, but it just felt right to complete that.
It did. So, and then for my colleagues, I do not see us needing the December 30th meeting. I'm going to ask staff to just delete that. It's traditionally we don't do a lot between the 25th of December and the 1st of the year. So, so I'll go ahead and just say that one goes away, and then we'll see what happens with committee reduction. But feedback on page 2, Councilmember Herrera.
Thank you, Chair. Great topics, real interesting stuff. The artificial intelligence and the impact on mental health. All ears on those things. The proactive approach to mental health in schools, really important stuff. And many other good ones on the opiate stuff, really, really good stuff. On the November 4th, on the veteran mental health, of course, I'm going to say more things on that. There's some, I don't know if we're going to get more specific on that, or we're just going to get a briefing from our director, or we're going to find some outside sources. I had a very good conversation with a researcher from Madigan who is studying veterans who have had traumatic brain injuries, but not to the ones that you can find markers where they got really blown up and you know you got blown up, but folks who just had an explosion by them, and then how that affects them 20 years later with their mental health. And they're teaming with the UW, University of Washington, and it was amazing what she had to say. And I thought veterans need to hear this type of stuff because they may think they're good or they've just been living it with 20 years and this is my new normal. But it was really neat stuff. So when these things come out, I might shoot them towards you. Pardon the pun. But I think it was really important, really interesting person. So I can give you more information on that.
Okay, thank you. Yeah, I think for me on that one of the areas was thinking about any services we're providing through the behavioral health tax in relation to that, like through the Cohen Clinic, and then any of our other ones, but always love hearing about new programs if they're close by. Okay, this is a test. Councilmember Krueger.
Thank you, Chair. And I don't know if I should ask this question, but I listened to a lot of different things. And I know at the state they're looking at legalizing, I believe, that cycle pill. I don't even know how to pronounce it.
Is it related to mushrooms?
Yeah.
Okay.
And listening to some veterans that have had an unbelievable history of serving this country have discussed that. And it isn't something I would want legalized, although because these guys are special. But what it has done, and I would think under the auspice of an assistant there of medical integrity, but I don't know if that is part of this or if that's maybe too deep for a county council. But it was kind of amazing to listen to how that helped them face their to confront that I don't even know what to call it. Those things. And that's just a thought on that. But I just kind of wanted to start at the top of the page on the leveraging youth employment and job readiness. It might be nice to have to convene a committee or a group of business owners to tell us what are the obstacles from them hiring youth. Because that is where I would think you would get the best experiences on the job. But when it's too much risk to do that, maybe we can alleviate some of those obstacles. Because there's nothing better than, I think, having to get up in the morning, being responsible to get your work done. That kind of a situation. Then, the AI, the role and the impact on youth mental. What does that look like? Is there a story behind that on the connection? When these kids can look up anything on AI, are they disciplined to look for the good and not for the evil? What was behind the thought on putting this on the agenda? Was there anything?
I can.
Vice Chair Ayala.
Thank you, Chair. I can speak to that a little bit. In terms of AI and the impact on mental health for youth, it's really the intention behind that is how socialization is happening or not happening now that we have this available and widely available to young people. And so we know that that middle school to high school age and up till 24 or so, there's a lot of brain development in terms of how young folks relate to adults and to community. And if they don't have that, or if they're not accessing that, there's a shift in how they're being socialized.
Okay, because just in understanding how brains can be rewired by what they're exposed to. And learning that from the years, from the young age on through adulthood. And I guess perhaps that would be very interesting. And also looking at all of the other subjects that they are exposed to and how that affects the brain and how they can, combat some of the things that they are exposed to. Then going into the nutrition and whole person health, I guess, and because I had commented before about looking at the different things of nutrition, how that can be healing, and I'm not quite certain on what trail that is going to.
I think,
And how deep into the person, I mean, how involved is government getting in setting up life for a person? That's just kind of what I'm seeing is we're designing the parameters for people to interact in. And I'm just wondering how this is relating to our job as council members versus getting programs that can be very dependent on government to continue for that person. I have to have the government to help me with this kind of a thing. I didn't know how deep this is going. What kind of apps, what are we looking at to solve here? And then the expanding opioid treatment programs. What do we have now?
great question.
Yeah, and can we afford to expand more? Why is it having to be expanded? What is going on that everyone's on these drugs? And the fentanyl awareness, I don't know how anyone couldn't be aware of it. And I don't know what the answer is to those kinds of things. Third spaces. Could I get some more clarification?
Ayala.
Please.
Thank you. I want to apologize. That's a very industry term. Third spaces are gathering spaces for people to exist outside of their workspace, home space, and it's really a community gathering. So examples that I've provided are libraries, community centers. I think there was another list in here. Churches. And so especially in rural communities, there aren't too many third space opportunities. Could be by design that they're not like that, or there could be opportunities for third spaces in those areas.
Okay, I guess I would beg to differ that being in the rural area and growing up in the rural area, that the people have all kinds of opportunities to do that without government interfering, kind of a thing, or taking the time on that. I find it kind of an interesting concept, but I guess I don't understand why that's something different. Because there's the parks, there's the 4-H, there's the sports, there's, they're already all doing that. And I don't know that they need help, and that's what I don't understand, why we would interfere.
I'll share. For me personally, I don't think it's about needing help. It's more of a pulse check on what's available and what we can share out and any opportunities that we might be missing.
Oh, okay.
And Councilmember Kruger, I think one of the things that I've heard both from Franklin Pierce, Clover Park, and Bethel that are in, I haven't heard from the Silicon School District, but I've heard it from those three, that many youth don't feel like welcome in places now, and so they stay home and they're on their phones staring at their screen. So then we go back to the topics earlier where kids are just basically living isolated, living with just social media or whoever's on the other side of FaceTime if they're doing that. But this idea of casual places where youth can go, because of liability, a lot of adult-run spaces that were open to youth maybe have started to shift, allowing just youth to come in. Just even youth walking in our malls now is perceived as problematic in large groups, so they don't go to the mall anymore, right? So it's third spaces is just places where youth feel comfortable going. And in Parkland and Spanaway and Graham, my youth that I worked with as an educator, they were at school and then they went home. That was their life. And so where do they go outside of that, where they feel welcome? And so that's one of the things that this was kind of getting at, is how do we think about it differently, and maybe creating more partnerships to create spaces that do feel welcoming for youth. So they do put their phones down and go do something, which all of us probably did as a kid, where you go play a pickup basketball game at someone's backyard. Like those kinds of things tend to not happen as much anymore.
I guess thinking that sounds a lot like my life, though. Even though I was a small town, it was school. There were all the different things to do, and I don't think that's abnormal. There just aren't places for everybody all the time, and I think that's part of life. But it'd be interesting to see on that. So,
Councilman, sorry, I do want to add another thing that we have heard, especially for senior services in terms of third spaces, is isolation. And so, though the context of this is youth, there is also a third space service for folks that are for seniors that don't have that accessibility, either because they can't drive or they don't have that community readily available.
And that I can agree with. I guess part of my concern is labeling things. Labeling everything is, we need something to call a third space for this when it's just part of life. And out in my area where I've got some great people working on the senior center and growing that, one of my constituents, her dad lived off 144th and Meridian. He had no way to get there, and he loved it. And he was vibrant. He got healthier. And there's only so much capacity that society has in being able to make everybody fit in somewhere. But that's part of, the role of their community to work it out and get things there. And I understand, seeing what we could do to help on it. But I think just, trying to label everything we identify as an obstacle kind of makes me wonder. And I'm very interested in the exploring programs for mental health crisis services. I guess I just don't understand, how did we get from, in the past 50 years to such mental health crisis going on? What is causing that? What's being projected into the minds of these kids that there's a breakdown of things? I don't know. But anyway, that's just my thoughts on things. Thank you, Chair.
Thank you for those comments. And we'll go to Committee Member Yambe.
Thank you, Madam Chair. Thank you, Councilmember Kruger, for that perspectives. I think that was important to kind of, balance, some of the terms that we're using, which are unfamiliar to some. But I think, to the point, I think that there are a lot of spaces that exist currently, but they're not always as inclusive spaces of everyone. And like you said, sometimes that's intentional and by design, and that's okay because, you can't hang out somewhere at night. But I do think that the lack of, places for people to gather, I think that the intergenerational aspects of being able to interact with all ages is also important, and government can provide facilities and things for people to do that on their own without kind of, saying, this is how you need to do it, this is how you need to interact. But I think that it's important that we have more of these spaces to address the needs of both, many different age groups, but also I think that it's even more important now as we're going into more technology and things that they have opportunities to interact with people of all ages. And, sometimes, you go to the Five Community Center and it's senior bridge time and, youth are very far away. But I think that at the end of the day, everyone appreciates the different perspectives and being able to hear each other and see each other and be exposed. And I think that's really important. So I think this is great for mental health and isolation and all those other things. So I appreciate these conversations. And I too sometimes am like, oh, can you define that for me? Because it's a very technical term, and sometimes you're like, well, that might have some, do you mean this? So I appreciate you asking the clarification. So thanks.
Thank you. And I played bridge as a kid with my grandmother at a senior center, just saying. Okay. Go to Vice Chair Ayala.
Thank you, Chair. For the September 2nd, I wanted to see if we can also add some language or some knowledge around pharmacies that mail in prescriptions, and what are the requirements for that to take place. this is also my ignorance. I'm sure there are some regulations there and some laws there that we can augment to the public around that as an accessibility point. And then for December 16th, under mental health crisis services, I think okay for our work plan language here, but if we could really define crisis services and what is understood under those two words, that would be great just for context setting in the presentation.
Thank you. We'll go to Committee Member Gruber.
Oh, I thought you said somebody else's name. Sorry. Thank you. I just wanted to comment a little bit on Committee Member Yambe in loneliness and isolation. I've had someone who is very involved in folks who are going through difficult times, and that is the crisis coming. And I think that is from 0 age on up to anything, the loneliness and isolation, because it's difficult to participate a lot in life. And I don't know why, but that would be, I think, kind of an overall theme or focus to think about too on opening up pathways that people can afford to go places and do what they need to do. Yes. Thank you, Chair.
Thank you. So this is a slightly different work plan model than we did last time, where I had 2 or 3 presentations almost on every single one. So I want you to know I intentionally went through and made sure there's only one. Some of these are pretty deep. They could be an entire committee meeting, but really trying to kind of keep things a little bit slimmer so that there's room for upcoming items or something that comes to our attention or any policy work that we're doing. And then as we move into the budget season, I think asking staff through that time to remind us and about some of the pass-through work that this county does through our Human Services Department, budget implications with FTEs, budget implications of our aging and disability group, some of those things, just as we're going to do a deeper dive or ask a learning of what those services are, so that when we get to the budget, we remember the purpose behind some of those things. So as we move into kind of the budget cycle, we are familiar with the human services side and the health side of the budget. And so when we get to the actual budget deciding, we're kind of ahead of the game, at least as a committee. So other than that, my one wonder is veteran services for mental health is one of the things that we've talked about. I know we also have spoken pretty deeply about veterans homelessness, trying to end veterans homelessness, and so maybe having either in one of our homeless meetings, our next meeting I think is on, to make sure that we're calling out how we're doing on our work to end veterans homelessness. That was a priority of this council before my time, I think before any of our time, and so just making sure that we're asking for that update. And if there was any other veterans services, because we are such a veteran-heavy county, I guess just let us know, because things are constantly changing. And then to the use of, I'm just going to say psychedelic mushrooms, the term that you brought up. I know the city of Tacoma just passed an ordinance that allows it in those situations, and maybe more broadly. I don't know what our rules are, so it might be something to refer to public safety around the legality of it, if it's something that we're interested, or if we just want to learn about it, then it would stay here. So maybe think about where we are on that, and then we can go there. But Committee Member Kruger.
Thank you, Chair. I kind of think learning about it so that we have an understanding would be the first objective.
Okay. In
knowing that. I really don't like drugs, but doesn't mean we shouldn't understand about it. And I'm wondering, who writes the mission for Human Services Department?
I would assume the executive.
I know it's been, I just, because I look at it and
We can ask Ms. Waterland to ask the
I will find out.
interim director.
Yeah, because we're, health and human services. And I guess I read this and I'm looking at it, I'm like, that looks like we're kind of designing a society. We're going to have all these things so everyone goes there, where I consider our role as, we have the basic services for people to use as needed, whereas this is quite a vision, I think. But anyway, it's beside just my comments on that. And I had one other thing. What was it? Oh, I'll have to think of it later.
Okay, as soon as you turn off your
Probably.
mic, you'll remember. That's how it always works for me.
Mm-hmm.
So, so any other feedback on the work plan itself? I do it happen. Committee Member Cooper.
Yes, thank you. The health department. So would that, although it is an independent agency, would that fall under this committee if we were wanting to have information? Because there are things there that I think the public would be interested in, since there doesn't seem to be a lot of interaction, I think, and maybe in all of the different things that they do, and maybe what the health department was originally designed for and how it has grown into so many different responsibilities, and I wouldn't mind an overview of the health department and how all of the things that they do, the different spin-offs and whatnot. And thank you, Chair.
Okay. I could see that being an entire meeting, just to kind of go over and have the different kind of levels of what they do and the different departments under the department. So
that might even be something for a study session, because it's not to change things, but it's just to have the knowledge transferred to the council.
okay.
Would be a thought.
Okay. We'll see what we can find out. We're also trying to meet with the Port of Tacoma and the City of Tacoma, but we'll see what we can do. But I definitely heard you, and I'm trying to figure out the septic system in my brain. You think this committee, though, as opposed to
That, either or.
Okay.
We'll get the information.
whichever can happen sooner?
But yeah.
Okay.
Yes, please.
Okay. Sounds good. I will take a look at some calendars and see where we are. Any other feedback? Okay. Ms. Waterland, is there other items, questions, things that you need from us?
The only thing that I wanted to share is that the Human Services Department is watching, and they're I'm not sure exactly her title right now, potentially
Interim director?
Deputy Director.
Okay.
Annika has provided this for me, which is that the Human Services Department wrote their own mission statement. Not exactly sure how the original mission statement was developed, but a few years ago they reviewed with staff and leadership groups and made a couple small wording changes.
Okay.
Thank you.
And thanks for listening. Okay, so I don't have any other items before the committee this morning, so just checking in if there's anything else.
And yes, to answer your question, there actually is nothing else.
Okay. So, so I am not anticipating us meeting on July 15th if we go with committee reduction, which I think that we will. I will be at NACO. I don't know who else is going to NACO annual conference. And then the December 30th, no, we're not meeting. So it just makes no sense. And so we'll see where we are. And then we will kind of go on to the next part. So we have our committee schedule for the year. Questions, comments, concerns? Okay, seeing no other business before the committee this morning, we are adjourned.